happens when you get sick or have an emergency, but there's no hospital near you. That's not hypothetical. We're sliding deeper every day into a hospital closure crisis. What will this mean for patients and healthcare workers? And what can we do about it? Trump's billionaire budget bill, signed July 4th, slashes nearly $1 trillion for Medicaid. When people lose coverage, their health needs don't just vanish. They show up at the ER and they leave with bills they can't pay. That means more working people crushed by medical debt and more uncompensated care that hospitals are forced to absorb. Follow me for a second. Safety net hospitals carry most of the load for working class communities. Roughly 1/3 of outpatient and nearly half of inpatient care at these hospitals is covered by Medicaid. Current estimates project 10 to 16 million people will get kicked off Medicaid, which means the uninsured share explodes, and so do the losses. The Commonwealth Fund projects average margins falling about 19% in expansion states, with safety net margins dropping about 56%, the worst of it hitting rural hospitals. That kind of hit will sink facilities and strain communities, urban and rural alike. This crisis didn't start yesterday, though. Since 2010, nearly 200 hospitals have closed or ended inpatient care. Even before the latest cuts, 1 in 3 rural hospitals was at risk of closing down, with nearly half already operating in the red if Medicaid expansion funding disappears. Even where doors stay open, whole departments are being axed. What good is a hospital that can't deliver the care you need? Since 2011, hundreds of rural hospitals from Florida to Pennsylvania stopped delivering babies. In places like Mississippi and Texas, many patients can no longer find chemotherapy clinics. And in the middle of this chaos, us healthcare workers are the ones ground up. When budgets are slashed or facilities shut down, workers face sudden pay cuts, mass layoffs, short staffing, burnout, and uncertain futures. Despite us being among the most trusted workers in the country, our bosses, the hospital CEOs, are ready to make us bear the brunt of this crisis. But workers aren't taking it quietly. From the Bay Area to New England to the National Veterans Health Administration, unionized healthcare workers are resisting cuts, fighting layoffs, and joining with patients and neighbors to defend care in their communities. All of this isn't accidental. It's about priorities. We live in an age of medical miracles, yet families are forced to pray for miracles on GoFundMe to pay for life-saving treatment for their kids. Here, healthcare is run for profit. If it doesn't make money, they don't care. Big pharma and insurance giants skim the most and send rivers of cash flow to shareholders, executives, and corporate owners. And corporate politicians aren't thinking any differently. The billionaire budget bill didn't just gut Medicaid and slash $300 billion from food assistance. It also delivered the biggest tax cut in U.S. history to the rich and corporate America, while boosting spending on deportation and war. No one asked us, hospitals or detention centers, but we know our answer. As closure threats spread, unionized healthcare workers won't take this lying down, and neither should we. Stand with us, pack the town halls, picket the cuts, and demand real investment in our healthcare. Healthcare can't be hoarded for the wealthy few anymore. It's a human right. And to win it, we've all got to fight.